90% of lumbar disc prolapse cases do not need surgery, and no one can push back that disc fragment inside. In this video, I want to address a very misleading trend these days of lumbar disc prolapse treatment. People are showing some kind of lumbar traction device, and after giving that traction, the disc fragment goes in. They will show the MRI in which there was a disc prolapse, and then after that lumbar traction, the disc fragment has disappeared. But this is not entirely true. That's not how the biology works. Studies show that many disc fragments absorb on their own with time. Rate of absorption is as high as 80 to 90% in certain types of disc prolapse. It takes time. The rough time that it takes to reabsorb is up to 6 to 8 months on an average. So what is the natural history of disc prolapse? Let's understand when there is a disc prolapse in the body, what actually happens. Disc has two parts, the inner soft core and the outer tough ring. When that outer ring weakens or tears, the inner fragment may bulge or slip out. This is called disc prolapse. Now here's the part which most people don't tell you. The moment the fragment comes out, your body recognizes it as something that does not belong there. And the blood supply around that area increases, inflammation increases, and over weeks to months, the body actually shrinks and resorbs that disc fragment. Yes, your body can actually break it down. And most patients improve with time and proper rehabilitation. Pain improves not because someone has pushed the disc back in, but because the inflammation has settled, the pressure has reduced, and the nerve has calmed down. So let me tell you, no therapy can push your disc back inside, no therapy can melt it instantly, no manual adjustment can permanently realign it in one session, and no treatment can cure it in 3 days. If someone promises you that they can correct your slip disc permanently without biology and time, then be cautious. Back pain in disc prolapse is largely inflammatory condition. It follows a biological timeline. You cannot hack biology. So what actually works? Targeted physiotherapy, activity modification, pain control when necessary, nerve calming strategies, core strengthening, and proper medical guidance. You may ask, when do we need the surgery? So surgery is reserved for only specific situations: progressive weakness, severe neurological deficit, cauda equina symptoms, or pain that does not improve despite adequate time and treatment of 3 to 4 months. Not simply because an MRI looks scary. Remember this, MRI shows only anatomy. Symptoms tell us the real story. In most cases, disc prolapse is a self-limiting biological event. Respect the science, avoid fear-based marketing. If your MRI is confusing you, seek clarity, not gimmicks.